on the contribution of quality of life research for policymaking. Very welcome to our symposium. In this symposium, during this symposium, we will have three presentations. The presentation of Dr. Francesco Saracino from Statec Luxembourg, the presentation of Dr. Joe Sirgy from the Virginia Tech, retired but still with us as our teacher, and my own presentation. I am Graciela Tonon from Argentina, Universidad de Palermo and Universidad Nacional de Lomas de Zamora. Now we will listen to Joe Sirgy. Thank you very much, Joe, to be with us today. A pleasure for me and an honor.
Well, thank you, Graciela, and thank you, Francesco, for inviting me to this panel. I only have one slide. Can I share that slide?
Yeah. Yes, okay. Yes, you can share with us.
I can share that one slide. There it is. So this presentation is not directed to quality of life researchers because quality of life researchers already bought into making the case that subjective well-being and other kind of well-being measures should be incorporated at the national level in statistics offices like census bureaus. And Francesco, for example, is one of them. So I'm trying to make a case to those other people who are involved in statistics offices throughout globally, but may be with us or may not be with us. Hopefully this presentation will be recorded and can be used to make the case that well-being measures, quality of life measures should be incorporated in bureaus of statistics globally. And the slide, as you can see, involves several things that I'd like to talk about. Why is well-being a very important concept for public policy? Why performance indicators currently used by public policy officials are inadequate and insufficient, and the use of well-being indicators in guiding public policy is easy and inexpensive compared to current state of affairs, and progress on the use of well-being indicators in public policy, and finally, the need to conjoin subjective and objective measures of well-being to guide public policy for future use. So let me start out with the first point, and that is why bother with well-being, with the concept of well-being, and why statistics offices globally should really take it seriously. Happiness or well-being types of concepts have been recognized throughout history. They're supposed to be the sort of the end goal in life pursuits, period. If you go back to Aristotle and the writing of possibly John Stuart Mill, Jeremy Bentham, on utilitarianism, for example, these philosophies have been grounded in the concept of happiness, in the concept of subjective utility, in the concept of happiness. And of course, with Aristotle has talked about eudaimonia, which is, again, a sort of a macro, all-encompassing concept that incorporates happiness, but other things like personal development and being a good person and contributing to the good society. There is one book that I like to make reference to that has been published in 2010 by the scholar named Derek Bach. And the title of that book is The Politics of Happiness. And in that book, Professor Bach, talked about why should policymakers use happiness research? And the answer, he provided three answers, and that is happiness as a human value is considered to be one of the most important goals of life, of living. The second reason is that it should be considered as a societal goal. It has been affirmed by influential scholars in modern times as well as in ancient times. Again, going back to the times of Aristotle. And third, we have to recognize, as Professor Bach has asserted, that happiness has positive consequences for society at large. You know, from civic engagement to kindness, to altruistic behavior, to living longer and working harder, right? Happy people tend to have these characteristics. And so do societies that have a lot of happy people. The second point that I'd like to emphasize is why performance indicators currently used by public policy officials are inadequate and insufficient. And in answering this question or addressing this point, I would like to make reference to our essentially our guru, our founding father of the studies of subjective well-being, and that's Ed Diener. And then we have Martin Seligman, who is the father of positive psychology. Well, both of them have strongly advocated for the development of a system of indicators to capture subjective well-being at the national level. You know, if you think about public policy at the societal level has been dominated by what you might call developmental economists. So the discipline of social development and economic development has sort of dominated public policy. That discipline has to change to look at subjective well-being and other measures of well-being and metrics and incorporate those as performance metrics. Let me give you examples of what's happening in other disciplines. Let's say I am a management psychologist. I've been a management psychologist for a long time. And therefore, my home disciplines are essentially marketing and management. Now, every discipline has its own performance metrics. For example, in marketing, we usually talk about performance metrics, for things like brand awareness, brand liking. So you focus on specific brands and the metrics, the goals of any marketer would be to try and enhance brand awareness, to try and enhance brand attitude, brand trial, brand purchase, brand loyalty, brand satisfaction. You know, these are the sort of the traditional metrics of marketing. Ultimately are related to economics. Economics meaning brand profitability. So again, those performance metrics are economically based. In management, especially in human resource management, again, the traditional metrics, performance metrics would be things like job satisfaction, job performance, turnover rates, absenteeism, organizational loyalty. These are the sort of, again, the traditional performance metrics related to human resource management. Now, those metrics have changed in marketing and management. Instead of talking about things like customer loyalty, we talk about consumer well-being, and we inject metrics, quality of life and well-being metrics in the field of marketing, in the discipline of marketing. And we're changing the landscape, the performance metrics landscape. The same thing with human resource management. Again, We're changing the metrics. We're not just talking about organizational loyalty and commitment or job satisfaction. We're talking about life satisfaction. Life satisfaction. How do you develop programs within the organization in such a way, not to just to get a person, an employee, to feel good about the organization and to stay committed to the organization, right? And ultimately maybe enhance employee productivity. Yes, I mean that is the bottom line. But if you're doing the right thing, we're linking it to life satisfaction, subjective well-being, eudaimonia. Again, these are the kinds of metrics that are now guiding human resource management. Well, the same thing can be said with developmental, the field of developmental studies. The field of developmental study has long been dominated by a different set of metrics, and these metrics are essentially economic metrics. GDP per capita, income inequality, unemployment, on and on. These are the sort of the traditional development type of metrics that have been used in this discipline. We need to change, again, the performance metrics of developmental scientists as well as policymakers that rely so much on developmental studies. And the metrics that, again, developmental scholars as well as public policy people that rely on developmental studies should be, again, things like subjective well-being, life satisfaction, eudaimonia. These are the measures that they should adopt. And in many situations, we are making progress. We're trying to convince more and more developmental economists as well as developmental scholars to do just that. And again, we'll be talking about that. The point about the use of well-being indicators in guiding public policy is easy and inexpensive compared to the current state of affairs. And in addressing this issue, allow me to go back to a specific publication by Ed Diener, back in very recently, 2018. And Diener and his colleagues sort of identify certain costs related to data collection of census bureaus. And the figures are 13 billion US dollars, at least in the United States, $13 billion to collect, census data every 10 years. In Australia, it costs around $440 million. Well, that was back 10 years ago. Now, compare the cost associated with the World Gallup survey. The World Gallup survey, it only costs $10 million, 10 million, compared to the $13 billion that it costs to collect data in the United States, census data. So the costs are exorbitant. All we need to do is just bring in a little bit more of the subjective well-being measures, or, in general, the well-being measures. So that cost of bringing in those additional measures is minuscule compared to the enormity of that census budget. The point on progress on the use of well-being indicators in public policy. Again, we need to go back to Ed Diener, essentially our founder, the founder of the subjective well-being studies. He has been the champion advocating the inclusion of well-being metrics in national accounts. Now, there are many international organizations, from the World Bank, the United Nations Development Program, the United Nations General Assembly, the Organization for Economic Cooperation and Development, the OECD, the National Academy of Sciences in the United States. All of these organizations have already adopted well-being metrics in their indicators programs. Well, in addition to the increasing popularity of the well-being measures among international agencies, we got several governments that have already adopted well-being metrics in their national account systems. For example, in 2010, the government of the United Kingdom began measuring subjective well-being to assist policy decisions. The government of Bhutan created and implemented the Gross National Happiness Index. We're all familiar with that now. It has gained significant popularity in the international community. In 2018, EDDINA accounted for 40 governments that have conducted national level surveys involving metrics of well-being and positive mental health. For example, Australia, Germany, Switzerland, the United Arab Emirates, the United Kingdom, even the talking about the United Arab Emirates, now that's kind of interesting, it has established a ministry of state at the state level, at the national, that focuses on happiness. The goal of this government agency is to institute programs that enhance the well-being of people living in the Emirates. Look at Ecuador. Ecuador has now the Minister of Good Living. I like the sound of that. Furthermore, we now have international organizations like the Gallup that surveys well-being in its Gallup Whirlpool, and then the Gallup Heathways Index of Well-being. So again, these are good examples of how well-being metrics have been propagated, internationally. Last but not least is the point that the need to conjoin subjective and objective measures of well-being to guide public policy for future use. So the idea is, when we measure well-being, we cannot just rely on subjective measures. We have to also bring in objective measures, and we need to do the kind of research that conjoin both objective and subjective measures. Robert Cummings used to be one of our ex-presidents, former presidents of the International Society of Quality of Life Studies. And he is a professor emeritus at Deakin University. He's written so much about how we need to conjoin subjective and objective measures of well-being. So he again, one of his more popular models that he talks about, well, he has his own theory of well-being, which has been widely adopted. And it's actually a great theory that builds on the concept of homeostasis. But anyway, he talks about subjective and objective measures of well-being. So the true measure of well-being is the condition in which the individual experiences a high level of both subjective well-being and good living conditions, actual, not perceived. Conversely, a true low level of well-being is the condition in which the individual experiences low subjective well-being and bad living conditions. Let me refer you to another quality of life scholar, again, and a very respected scholar within the International Society of Quality of Life Studies, Ruth Vinhoven, a sociologist at Erasmus University. Now, Professor Vinhoven has long discussed and championed the idea of conjoining objective and subjective measures of well-being. As a matter of fact, he developed his own index. Probably some of you are familiar with that index. It's called the Happy Life Expectancy. Happy Life expectancy. So that particular index is an example of how quality of life and well-being scholars should be doing this. He combined life expectancy, which is an objective indicator of well-being, and mixed it with subjective well-being to come up with a composite index. It's beautiful. It is absolutely beautiful. But it is a good example of how, again, people in statistics offices throughout the world we should combine both objective and subjective measures of well-being to develop their own indices. But both of them have to be incorporated. Professor Vinhoven also posed a very interesting and a very thought-provoking article. And this was published back in 2009, and this is essentially my last point. And in that article, the title of that article is Well-Being in Nations and Well-Being of Nations. In nations versus off nations. Is there a conflict between individual and society? In other words, do societies prosper at the cost of its members? And conversely, can people prosper at the cost of society? The answer to this question is that the data demonstrate no inherent conflict between personal happiness and societal quality of life. That should be the case. So again, he made reference to the Happy Life Index as an example. So the idea is, when we're talking about objective measures of quality of life, besides life expectancy, we can talk about things like biological capacity, economic competitiveness, military power, and integration of the world system. These are societal measures of quality of life and well-being, right? Not at the individual level. So the challenge then is to be able to take the individual subjective well-being data and combine them, develop composite indices, right, with those societal measures that reflect societal interests and not necessarily individual interests. And I'll leave it at that. Thank you so much.
Thank you. Thank you very much, Joe. A question for Joe. This is, do you think policymakers are more sensitive, receptive to subjective or to objective measures?
The answer is pretty obvious, already discussed. And that is that, of course, they're much more interested and much more receptive in the use of objective measures of well-being. As I mentioned, they're so much influenced by developmental economists and the whole field of developmental studies, and most of the metrics that are so popular in that field of study or that discipline tend to be objective indicators of quality of life and not necessarily subjective indicators. And as a matter of fact, in my experience, when I run into developmental economists, they sort of completely brush aside subjective indicators. They think this is the fluffy stuff. They don't take it seriously. So it's unfortunate. Yeah, we need to, again, hammer on the issue that subjective indicators can make a difference.
Mm-hmm. Well, we have another question by Kimberly. Thank you very much, Kimberly, for you, Joe. And this is the question. If the USA would start to collect quality of life data on a massive scale, what new insights would we gain that could be acted upon? We have no universal health care, shrinking budget at the municipal level that limit community services in location that need the most help, and very little support for taxation that would redistribute wealth. With more quality of life data, communities that need the most help would be identified, but few ways to address it, And in my opinion, this diminishes the interest in collecting the data. What is a very, very large question, but well, what do you think about it, Joe?
Kimberly, would you identify yourself?
Kimberly, I can't, Kimberly is here.
I see it.
Okay.
Can we see?
I'm here. Sorry, my camera's not set up. I'm just realizing, but I'm here. Hi.
Okay, but it's
How are
here.
you? Can you hear me okay?
She's Kimberly. She's
Right.
Kimberly.
It sounds like it's more of a comment than a question, but that's a good comment. But it seems like you have the impression that quality of life data is nothing but subjective well-being data, and of course that's not true. So all of the issues that you raised in this comment can be addressed by other objective quality of life indicators. And these other objective quality of life indicators can be used to, again, to guide taxation, redistribute wealth, on and on. All of these things are beyond the subjective well-being data or indicators, correct?
Yeah. I am working on a project now about quality of life in small and shrinking rural communities in Iowa. And we use your research and the idea of personal utility in the project. And I guess the comment comes from my frustration that people don't seem to want to know, because if they know things, they get frustrated when they can't be acted on. So in other words, the transparency of collecting the data and knowing more about what the problems are with both subjective and objective quality of life, we can identify communities that are really suffering, but nobody wants to invest the resources in those communities that need that help. So there's a kind of, I don't know, they appreciate the data gap that's there, because then they are not forced to actually confront the issue head on. This is more the direction of my comments.
Right. Well, I sympathize, and I certainly understand the frustration. I've been involved with community indicators projects over the years, and this is exactly what I've been finding, especially when you have people of the sort of the political divide involved in these indicators projects. Like, for example, in the United States, we have a huge divide between the conservative Republicans and, of course, the liberal Democrats, a huge divide, right? So let's say the liberals or the liberal Democrats, what they would like to do is be able to demonstrate very clearly that we have problems with the environment, we have problems with the poor, we have problems on and on, you know, with those issues that liberal Democrats are very much interested in. Republicans, on the other hand, they're interested in exactly the opposite, right? So they want data that would support their vantage point, their point of view, their political initiatives, so to speak. But that's part of human nature. You're going to end up, again, with people wanting data that would support their point of view, because, again, that's how we think, that's how we feel, this is how we act.
Yeah, this is what we see in Iowa, that, you know, if we collected this data, the liberals want to put money into it. And if you collect this data, the Republicans want to blame people for not taking care of it themselves. But I guess I don't see a kind of lobbying organization to spend the money to collect more data for this reason, because like there's nobody who's making this push to collect this data. That's my observation for both reasons.
You know, over the years in the United States, we have so many indicator projects in so many cities, so many communities. And for a while, we thought we're so proud of this momentum that has been achieved in the United States. But lately, I've been noticing that a lot of those indicators projects have folded. They shut down. And this is because, again, the kinds of things that you're bringing up. And it's very unfortunate. Yes, we, you know, an organization like ISCOLS should champion and push for those types of indicators to help you guys at the ground level, so to speak, do your job. Yes.
Thanks.
Okay, thank you very much, Joe. And thank you very much for all first for the presenter, for my colleagues. I am very happy to see you and to be with you sharing this symposium. Thank you very much for all the people that participate with our question and the people that are listen to us. You can contact us after this. And well, I hope you can continue enjoying this extraordinary conference of more than 4 days, on online conference of ISCOLS. That is the first time we organize a conference like this. And I think all of the members of ISCOLS are very, very happy to this opportunity. So I don't know if Francesco or Joe want to say something at the end, please, if you want.
Well, Kimberly, thank you for sending us this link. I'll be looking at it. But thank you all for attending and participating and getting involved in public policy, because that's the ultimate aim of what we're doing in terms of developing and championing those metrics of well-being. So thank you all.
How to add on top of what on Joe's conclusion. Thank you, Graciela. Thank you, Joe. Thank you to all of you for making this session possible. Take care and stay safe.
You too. Bye-bye.
Thank you, everybody. Have a good day.
Bye-bye all.
Bye.